So welcome everyone to the informational call about the Health Improvement Alliance Europe. I'm going to take a minute to ask my colleagues to introduce themselves so you'll get to know us a little bit. My name is Angela. I'm a project director for IHI and I'm located in Toulouse, France. Andrea, would you go next, please?
Sure. Hello, everyone. My name is Andrea Cavaco. I'm a project manager for the Alliance, and I'm joining from the top of Portugal. Pedro, I think you're next on my screen.
Hi, everybody. Pedro Delgado, Vice President for IHI and based here in the UK. Jason?
Yeah, hi, everybody. I'm Jason Leach. I'm Senior Fellow at IHI and now a faculty member, and I was, until a couple of weeks ago, the National Clinical Director of the Scottish Government. I'm confused today because I'm in Scotland and the sun is shining through my window. It's all very disorientating.
Hi, everybody. I'm Susan Hanna. I'm a Senior Director in the IHI team in Europe, and I'm also based in the UK. Patience.
Thanks, Susan. Hi, everyone. I'm Patience Manyao, Associate Project Manager, based in Johannesburg, South Africa. Thanks. Back to you, Angela.
Thanks so much, everybody. Pedro, I'm going to hand things over to you. I'll go ahead and share the slides and give you the control.
Thanks, Angela. And for those attending, feel free to put your hands up at any point during the conversation. We will have time for Q&A. And what we will do is to describe a little bit of the kind of background to the Alliance and very quickly the history, the activities, and give you a really good flavor for what the Alliance will look like starting in September. So for year 9, we'll also hear from Jason, his experience as a member. But it's a privilege to have you here, and we're looking forward to continuing to build on this ambition to inspire change and connect and convene. IHI, as a non-for-profit, has a mission and a vision that's very aligned to the people who are members of the Alliance, which is around improving health and healthcare worldwide, and a vision that this happens for everyone, best health and healthcare possible. And those values of courage, love, equity, and trust are values that we carry on our sleeves and we try to embody in everything that we do in the planning and in the doing of the Alliance activities. The people that we're serving, the people that you're serving, patients, families, and caregivers, communities, the workforce that we all care about deeply and we're part of, and then health care and health systems transformation. So this is a little bit about the kind of hosting and convening organization, and it's all underpinned by an ambition to leverage the best of improvement science in order to bring about tangible results, which we know you're all working on. You have strategies, you have populations, and you have an intent, and the intent is usually around impact. The impact is connected to one of these 5 areas. Every health system across the world has an umbrella set of things that they're trying to achieve, and it's primarily or largely around these 5 things: best possible health, best possible care at sustainable costs, with staff who are well, and then with an emphasis on equity so that no one gets left behind. What we in the Alliance and the members of the Alliance work towards is this idea that everyone has room to improve, and everyone has something to teach, and everyone has something to learn. So when we come together, it's to serve as common challenges across the settings that are part of the membership and within the regions, to develop even more innovators and encourage innovative thinking in the way that we interact, again, with an all teach or learn spirit, to leverage ideas and kind of cross-share ideas, to use, when it's feasible, when it's possible, and when it's valuable, the sense of collective voice. You'll see some examples like the population health improvement paper that we wrote for BMJ, and the curiosity, simple rules for leadership, and so on, and to continue to integrate, and not just the learning from this alliance, but the learning from our events like the IHI forums and other alliances like the sister alliance in the US. The membership is quite varied. We have delivery organizations, we have think tanks like the King's Fund, we have regulators and improvement organizations that are regional or national, like the Danish Society for Patient Safety. The membership is primarily, but not limited to, Northern Europe. So a lot of UK members, members from the likes of Iceland and Denmark and Sweden and so on, and also a couple of members from Southern Europe, namely Spain and Portugal. We also have, as of last year, the first ever city council, which is very exciting because many of the systems across Europe and frankly across the world are in a process of integrating. And in that integration, the opportunity to partner even closer with the local councils or municipalities becomes a reality. So Westminster City Council, who are working on a very ambitious population health improvement agenda that includes their hashtag 2035 effort to reduce the life expectancy gap between the wealthiest and the poorest neighborhoods across the council, joined, and they continue to be just a powerful voice in the alliance and a brilliant, super active member. You know, the structure you'll hear about in a bit, but this is the kind of thing that we do when we get together in person, which is a few times a year. We go and visit, we go and see. This was a visit to Pärnu Hospital in Estonia, which we did last June. And not to scare you, but part of the meeting structure in Estonia, including a sauna set of meetings. This is very unusual, but we always try to honor local traditions. Just like when we were with Jason, we visited one of the Royal Colleges and had dinner at a very historical room. We try to do that everywhere we go, and it'll be the same when we go to Belgium in a few weeks here in June. The membership is also very centered on the people that are part of and partners in their care, the users, the service users, the patients, and so on. So on the left-hand side, you see a visit to a residential care home where we spoke to the people that live in the care home, and they spoke about how they partnered to help improve the system. And the top right, you'll see a partnership with a food provider organization for children at risk of food poverty in London, which is a beautiful project. And we actually were, as part of our visit, able to assemble the boxes that had a secret recipe inside and the key ingredients, which gets delivered to the schools every Friday during the school year. And then at the bottom, you'll see a meeting in Leeds that was facilitated the entire time by service users. So it was very much led by and through their voice. You know, again, the ping pong tables are to combat loneliness in Copenhagen. So when we visited Copenhagen, we were able to see this project. And then you see the spirit of the Alliance members who develop not just a technical set of relationships founded upon their ambition to serve better and more impactfully, but also friendships. You know, they're human beings that have feelings, that have likes and dislikes, and that usually find common ground to connect within the sphere of improving and innovating, but also within their human sphere, which is just brilliant. So with that, I'll pass it over to Susan Hanna, who's going to describe a little bit of the flavor of the Alliance activities. Susan.
Yeah, great. Thanks so much, Pedro. I guess one of the really powerful elements of this alliance is that there are wonderful opportunities to come together in person and to build those meaningful relationships and strong connections. There are also many opportunities to connect through our virtual offerings. So webinars that host speakers, global leaders on subject matter. bringing expertise and experience from the field with really helpful insights and shared learning opportunities for members to bring your broader organisational colleagues to come and learn alongside you in this work. So an example of that's Kate Hilton. She was a co-author of The Psychology of Change. She's faculty with IHI, and she is a very inspiring speaker around the importance of improvement, but also the psychology of how we move improvement forward. We also have subject matter that's very topical and bring expertise from the field and from experience of doing the work in healthcare around things like climate action. Of course, Jason has been involved in some of that work in Scotland in recent years, and we've benefited from learning there. Thinking about not only hospital-based quality, thinking about safety, reliability, effective care, and sharing insights and learning from that field, but also thinking about population health, thinking about what does it take to build health as well as improve our healthcare. So a whole range of virtual roundtables, deep thought leadership, and exchanges over webinars. Really helpful and powerful interactions that often lead to deeper learning as smaller networks within the Alliance. We also run work groups. So the work groups are identified, the topics are identified by the members. We always check in with the members, find out what matters, what really matters to them, what is going to be important for them to go deeper on, to learn together with other network members around. And these are some of the work that we've done there. So we've done work on equity, thinking about health inequalities, population health. The IHI's Triple Aim has played a significant role in guiding some of that learning. Publications coming out of population health work that the Alliance has done. And we've done work on waste and improving how you add more value to the system. This year, we've been doing some really nice work around well-being of staff, and we're gathering a catalogue of learning from across our membership on what people do to support and sustain the well-being and joy for people in their work. And that has been quite a powerful journey for many who have joined those conversations. And there's an ongoing conversation in a work group around leadership and how do we really lead well, think about quality as an aspect of our role, and make sure that we're having the right level of influence and providing the right level of support for the quality system. So lots of work in these different areas, these work groups and in these webinars and virtual learning. But actually, you know, the connections that are built through the Alliance are incredibly powerful. And I see not only a large convening of people from across Europe, but also the small connections that people make, the relationships they build in order to help them go deeper on things that really matter to them. And even in these photographs, I can recognise people who have formed closer relationships, people who would never have come across one another before they joined the Alliance. And they've been able to have small group meetings and shared more learning across each of their systems together as an aspect and an added benefit of being part of the Alliance group. So that's just a little bit of insight into some of the additional offerings that come along with this Alliance group. And with that, I'm going to hand over to Jason, who is going to tell us a little bit more about the context of Scotland and the journey that they've been on.
Yeah, so Susan, I think, has touched on the secret sauce here. And it's why Scotland has been committed to this network. And it's one of IHI's key skills, I think, in its convening power. And that convening power both happens formally. So you've seen some images now of where that happens formally. So you get invitations to come together. And that's a kind of easy to understand networking opportunity. But actually, the stories I'm going to tell you briefly are almost what develops from that formal networking, because there is work in well-being and advancing quality inside those work groups, and it's crucial. But actually, the real value has come from individual conversations and individual relationships that this group has allowed Scotland and the people within Scotland to form. So just to get you to orientation, this is us. From the top to the bottom, that's Shetland away in the north, closer to Norway than it is to Edinburgh, and mainland Scotland, but lots of healthcare in cities, 1.5 million people in Glasgow, where I am, 29,000 people on those islands in Shetland, all expecting the same healthcare, of course, and similar challenges to the rest of the Western world. We're struggling for money, struggling for a workforce, struggling for quality. So all of those same things that everybody else recognises, and we're better, of course, if we can do that with other people together. So 5.5 million people, 19 billion pounds worth of spend from central government. So how can we use that wisely? And somebody much wiser than me said that the health and social care problems of the world have all been solved. They just all haven't been solved in the one place. They've been solved in a variety of different places, and we just need to find them. So I think Scotland leads the world in some elements. I think Norway leads the world in other elements. And bringing that together is one of this alliance's key skills. So Scotland has joined in a number of ways, maybe a little bit uniquely for a country of our size. So we've joined as a nation. That's the Scottish Government and the National Health Service. So that was where I worked up until 10 days ago. So we have joined the network as a country, but we've also joined the network as individual health systems. Now, they are centrally controlled by government, they're funded by government, but they have their own boards, their own executives, their own employment for doctors and nurses and physios, of course. So we've had boards also join the network, and it's a slightly different way of engaging, of course, because my world is policy leads and chief medical officers, chief dental officers, that kind of world. And then the boards are engaging in the front line. So what's happening in your intensive care unit? How are you retaining staff using your wellbeing work? So both of those things have been available. And just to give you a couple of tiny examples, this is Scotland's quality journey, which warrants further discussion. But the IHI network of whatever evolution it was on has been involved at each of these steps. We did our safety work with IHI, we did our children's and education work with IHI, and a number of other elements across here. And the Healthcare Improvement Alliance Europe is the latest version of how we bring those individuals together. But to make it a little bit more real for you, perhaps, the young lady on the left of this image is Jen Rogers. She is a senior nurse in Glasgow's Children's Hospital, or she was until quite recently. And the man on the right is a senior quality improvement and safety academic from Norway. They didn't know each other. They didn't even know each other existed. They both sat in the same room, heard the same talk about a thing that you might have come across, and it's called What Matters to You. They then went back to their own countries, set up a What Matters to You thing in their context. So I remember Jen coming to me and saying, we're going to do this What Matters to You thing. Unbeknown to us, Anders does the same thing in Norway. And the alliance brings them together. The two countries meet. The Norwegian system and the Scottish system meet. And now there is What Matters to You Day around the world. Some of you may well have engaged in it and not known its origins. Well, these two are its origins, having heard a number of individuals on a big stage talk about it. And that's where the microsystem then makes a change. You then take that into Scotland and you do it. So this is every single room in our new build hospitals have a What Matters to You board on the wall. So that it might feel a bit nebulous somehow, networking. And I like it like everybody else likes it. But actually the reality of it is it leads to this. So today in a hospital 2 miles from my room where I'm sitting right now, there will be people being admitted and writing in the What Matters to You board what happens as a direct result of the convening power of IHI, the networks created, and the intra-country connections that make this possible. Now, in Scotland, this will be filled in with football teams' names and dogs and haggis. And now in Norway, it looks slightly different. And in Georgia, it will look different again. But the premise is the same. And that's what the networking, I think, leads to. That has led to Scotland networking in its own right. So we now provide improvement science courses, let's call them, along with IHI, but we do it for the world. So you can see along the bottom here, all the countries who have come to Scotland to learn this world, and we charge the Norwegians a little bit extra, and then we give it to the Scots a little bit cheaper. You understand how these things work. But that networking makes this kind of work possible, because now we've got a room with a table of people from Norway, people from New Zealand, people from Ireland, all sharing the same experience, and it makes it so much more powerful. And the network has made that possible. Now, this lets me just transition to my final story, and that is we've moved beyond health and care in Scotland with these same methods. And that is a lonely journey because there's not many countries have done that. And the Healthcare Improvement Alliance Europe has allowed us to start to meet like-minded individuals. In fact, we've gone even further and we've joined the networks that IHI has in North America, in the Middle East, and other parts of the world. But this work is not just obstetricians and midwives, it's also prison officers and teachers. So it changes the dynamic entirely of what it is you're trying to do. And this is our big kind of flagship program in this world. And Susan, before she went to work for IHI, led a lot of this work in Scotland and has taken the heart of it with her. And this is bringing together all of these groups of people. Now, I show you this because we don't know how to do this. We know it needs done. It's literacy, numeracy, it's prison population, it's climate, it's social workers, but we don't know what to do. We know the method, and IHI has taught us that method over 15 to 20 years, but we don't know what the change package is. We don't know what the changes are that we need. We therefore need help. And that help we find in our networks that IHI helps us convene. And this is an image of IHI people, people from overseas, people from me when I was a little bit heavier than I am now, unfortunately, or fortunately, perhaps. And it brings together the thinkers of the world to allow us to tackle the Scottish problem. So we selfishly present to that network, we want to improve the literacy of Scottish children, and we don't know what to do. Does anybody do that? So we find a person in Denmark who cares about that, a person in Estonia who cares about that, and we bring that group together and we accelerate the work. I'm simplifying it slightly. Of course, it's messy. Of course, there's bumps in the road. It's not straightforward, but at least we're doing it together. And that power, small p power, I think is what this network gives us. So Angela, I think I'm heading back to you.
Yes, and I'll invite Andrea to come in. Go ahead, Andrea.
Thank you so much, Angela. And thanks, Jason, for translating what has meant to Scotland. It's really nice to see. So this is just to provide a little bit of the flavor of the all share, all learn ethos from IHI and sort of some of the activities to summarize what the different types of things that we do and that we have planned for year 9. So we bring people together in person and virtual meetings. So in year 9, we'll have 2 in person and 1 virtual meeting. We'll have interactive workshops, we'll have the go-see visits, so where the members have the opportunity to go and see other interesting from the quality perspective organizations, healthcare or not. We also have some plenary presentations, networking opportunities, and we organize these with the co-hosts that will receive us. So there's also an opportunity to present the work of these healthcare systems and to learn. A little bit to what Susan has alluded, we have a collective impact working group where we look at making progress in a shared priority. So as Susan mentioned earlier, we're looking into understanding what the priorities are for our members and then sort of convening and facilitating that group and bringing in expert faculty. So as, for example, of Kate Hilton that Susan mentioned before. We also have a learning and action cohort. So this is designed to share learning across member organizations on, again, a topic that is determined by the members, and we bring people together and also expert faculty when appropriate. We tend to have virtual roundtables and all member webinars where we showcase not only the fantastic work that our members do, but we also invite other speakers to present of topics that are of interest, for example, AI in healthcare and others. And we also promote discussion. We have a very great group of people we're also always ready to jump in with some ideas and suggestions. So we promote a lot of that discussion. We also have the Accelerators Network that we do in partnership with our US-based alliance. So again, the members tend to work again on a shared priority, and here they use the rapid testing and learning methodology. Recently, we also started the CEOs and the Chief Quality Officers convening. So essentially, they come together with our sister alliance in the US and convene for quarterly discussions. And there's also opportunities to meet in person on our national forum. We host the BMJ-IHI International Forum in Europe. So we were all together in London last year, and there's some people that I recognize on the call that were there with us. So we provide networking opportunities both at the National Forum and also at the International Forum. And in this year, we're going to continue the Alliance Peer Improvers, which is a small cohort of members where they come together to co-design what they would like to learn and to have to go and have site visits on each other's organizations to really see in person this what our other organizations are doing, to learn and to bring back what they've learned. So this is some of the activities that we offer. We would just like to talk to you as well next about the connections to colleagues in. So essentially, we joined our leadership alliance in the US, and we try to do that through a number of activities. So we jointly convene work groups on specific areas. As I mentioned, we provide networking opportunities. We're also having quarterly CEO connections calls, so CEOs that would like to be part of the CEO connection, they connect quarterly. We also offer memberships into the IHI and CQO network. So the CQO is the Chief Quality Officer, so we have cohorts from the US and cohorts from Europe that are also joining together. And we also share activities around the Breaking the Rules for Better Care initiative. So just on the next slide, this is just for you to have a sense of when these activities are planned. So we kick our year 9 in October. So we're going to have a virtual launch on the middle of October. And then we will have an in-person meeting, which we're planning. In December, there's an opportunity to come together for the IHI Forum in Florida. And as mentioned, we'll have networking activities and other series of activities. January and February, we'll have the webinars that we've been talking about, either where we showcase the work that members do or come together to look at a specific problem or invite other members. And we survey our members for them to give us a sense of what they would like to see. In the spring, so around March, April, we'll have our in-person meeting. We'll come together in May in Utrecht for the International Forum, and then we'll have another webinar in May. We'll have a virtual meeting where we'll have a series of interactive sessions, and then we'll have a summer, and we'll close in the September webinar. If you have any questions, please do reach out to the Europe team. The email is here. And if you also want to scan a QR code, this will take you to a form and we'll follow up with you directly, and we'll happy to schedule a call.